Hi friends, welcome back to 1000 questions and answer series. First question, harsh vibrating shrill sound produced during respiration as seen in upper airway obstruction is stridor, wheeze, air hunger, sigh. And the answer is stridor. Next question, water hammer pulse is seen in aortic regurgitation, digitalis toxicity, myocardial infarction, heart block. And the answer is aortic regurgitation. Next question, type of pulse in which rhythms is regular but volume has an alternative strong and weak character? Pulse alternans, bigeminal pulse, paradoxical pulse, 3D pulse. And the answer is pulse alternans. Next question, pulse in digitalis toxicity, bradycardia, bigeminal pulse, paradoxical pulse, 3D pulse. Answer is bradycardia. Next question, full volume pulse but rapidly collapsing pulse is water hammer pulse, pulses alternans, thread pulse, pulse paradoxical. And the answer is water hammer pulse. Next question, another name of water hammer pulse, Corrigan's pulse, collapsing pulse, pulse alternans, A and B. The answer is both A and B. It's known as Corrigan's pulse, also known as collapsing pulse. Dash is accompanied by an irregular rhythm in which every other beats come early. The premature beats feels weak due to inadequate filling of the ventricle between the two beats. Bigeminal pulse, water hammer pulse, pulses alternans, paradoxical pulse. Answer is bigeminal pulse. When should the nurse collect the sample for sputum analysis? At the evening, just after breakfast, early morning, after aerosol therapy. And the answer is early morning sample should collect. Next question, which artery is the most preferred one for arterial puncture of ABG analysis? Femoral artery, radial, brachial artery, internal iliac. And the answer is radial artery. Next question, which test should be done before doing arterial puncture at radial artery? Allen's test, Romberg test, Kuchen test, caloric test. And the answer is Allen's test. Identify the correct nursing intervention for a patient after bronchoscopy. Increase fluid intake, monitor urine output, give oral fluid only after return of gag reflex, maintain NPO for 1 day. And the answer is give oral fluid only after the return of gag reflex. Which of the following food can be given for a patient immediately after a bronchoscopy? Options are liquid diet, soft diet, semi-solid diet, none. Answer is none. Next question, primary risk factor in development of cancer of larynx, chronic allergy, chewing tobacco, exposure to dusty environment, smoking. And the answer is smoking. A patient with COPD should have oxygen administered by nasal cannula at the rate of 10 liter per minute, 1 to 2 liter per minute, 5.1 liter per minute, 7.5 liter per minute. The answer is 1 to 2 liter per minute. Tracheostomy suctioning at a time should not exceed 10 seconds, 20 seconds, 25 seconds, 30 seconds. And the answer is 10 seconds. An increase in rate and depth of respiration with alternating period of apnea, stridor, polypnea, Chinese choke respiration, then wheezing. The answer is Chinese choke respiration. Which of the following diagnostic technique is used to confirm pneumonia? Sputum culture, ESR, laryngoscopy, chest X-ray. And the answer is sputum culture. Next question, which of the following is not an accepted method of collection sputum from patient? Direct spit out method, sterile suctioning, transtracheal aspiration, gastric lavage. Answer is gastric lavage. Which of the following is restricted for a patient preparing for pulmonary function test? Salbutamol, atropine, INH, streptomycin. Answer is salbutamol. Which of the following to be done before taking samples for ABG analysis? Allen's test, Ellen test, suctioning for 30 minutes, both B and C. Answer is Allen's test. Next question, Mantoux test is a skin test, sputum AFP, chest X-ray, sputum culture. Answer is Mantoux test is a skin test. Next question, which test is most accurate for the diagnosis of pulmonary TB? Mantoux test, sputum AFB, chest X-ray, sputum culture. Answer is sputum culture. Next question, maximum amount of fluid that can be removed during thoracentesis: 500 ml, 750 ml, 1500 ml, 2000 ml. Answer is 1500 ml. Next question, bat's wings appearance in chest X-ray is indicative of pulmonary edema, pneumothorax, left ventricular failure, CA lung. Answer is pulmonary edema. Gold standard investigation for pulmonary embolism: chest X-ray, echo, D-dimer, pulmonary angiogram. Answer is pulmonary angiogram. What is the confirmatory test for tuberculosis? Bronchoscopy, sputum culture, chest X-ray, tuberculin test. Answer is sputum culture. Next question. SARS is spread by virus, bacteria, fungi, protozoa. Answer is virus. Next question. In water drainage system, cessation of fluid fluctuations in drainage tube means lung has fully expanded, lung has collapsed, mediastinal space has decreased, chest tube is in the pleural space. Answer is lung has collapsed. Next question. Which of the following is an earliest manifestation of inadequate oxygenation? Diaphoresis, cyanosis, restlessness, hypertension. Answer is restlessness. Next question. Which of the following helps to identify flail chest in patient with chest trauma? Multiple rib fracture in chest X-ray, decreased movement of chest wall, tracheal deviation, paradoxical chest movement during inspiration. Answer is paradoxical chest movement during inspiration. Which of the following is an intervention for a patient with COPD? Pursed lip breathing, chronic steroid therapy, high flow of oxygen, high carbohydrate diet. Answer is pursed lip breathing. During the post-operative care of nasal surgery, which of the following indicate bleeding even the nasal pad remaining dry? Complaints of nausea, repeated swallowing, increased respiratory rate, increased pain. Answer is repeated swallowing. Earliest sign of acute respiratory distress syndrome: bilateral wheezing, inspiratory stridor, intercostal retractions, increased respiratory rate. The earliest sign is increased respiratory rate. Barrel chest is a sign of emphysema, bronchial asthma, chronic obstructive bronchitis, bronchial asthma and bronchitis. Barrel chest is a sign of emphysema. Next question. Dietary prescription for client with tuberculosis is potatoes and fish, egg and spinach, grains and broccoli, meats and citrus fruits. Answer is meats and citrus fruits. A client began a 6-month course of therapy with isoniazid. A nurse plans to teach the client to use alcohol in small amounts, report yellow eyes or skin immediately, increase intake of Swiss or aged cheeses, avoid vitamin supplements during therapy. Answer is report yellow eyes or skin immediately. Chronic cough is cough lasting more than 2 weeks, 1 week, 3 weeks, 8 weeks. Answer is chronic cough is cough lasting more than 2 weeks. Next question. Facial mask is used at flow rate 5 to 8 liter per minute, 10 to 20 liter per minute, 2 liter per minute, 15 to 20 liter per minute. 5 to 8 liter per minute. Which of the following is associated with coarse crackles? Interstitial pneumonia, tumor, obstructive pulmonary disease, asthma. Coarse crackle seen in obstructive pulmonary disease. Low pressure alarm in ventilator indicates patient speaking, increased secretions in airways, bronchospasm, client fights with the ventilator. Low pressure alarm in ventilator indicates patient is speaking. Which of the following is not included in COPD? Emphysema, chronic bronchitis, bronchial asthma, none of the above. Answer is bronchial asthma. Next question. Which of the following condition is described as one patient is drowning is on fluid? Common cold, rhinorrhea, pulmonary edema, pleural effusion. Answer is pulmonary edema. Which of the following is a characteristic percussion sound of large pleural effusion? Dullness, resonance, flatness, timpani. Answer is dullness. Which of the following is the therapeutic position for a client with rib fracture? Prone position, supine position, Fowler's position, Trendelenburg position. Answer is Fowler's position. Inward movement of segment of thorax during inspiration with outward movement during expiration is termed as rib fracture, flail chest, paradoxical respiration, pulmonary contusion. Answer is paradoxical respiration. Next question. Which of the following immunoglobulin is a mediator in asthma? IgG, IgA, IgE, IgM. And the answer is IgE, immunoglobulin E. A distinguishing feature of lower airway and pulmonary vessel disorder is cough, chest pain, dyspnea, abnormal breath sound. Answer is dyspnea. Next question. Life-threatening complication of asthma: pneumothorax, status asthmaticus, emphysema, bronchiectasis. Answer is status asthmaticus. Next question. Biot's respiration is the classical sign of cardiac tamponade, injury to medulla, pulmonary edema, both A and C. Biot's respiration is seen in injury to medulla oblongata. And the last question. Which of the following sign after bronchoscopy is immediately reported to physician? Blood streak disputa, dry cough, bronchospasm and hematuria. Answer is bronchospasm. Video ഇഷ്ടപ്പെട്ടെങ്കിൽ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, സബ്സ്ക്രൈബ് ചെയ്യുക, and thank you to everyone.